Have you ever experienced a sudden, frightening bout of severe coughing and a whistling sound in your chest, making it hard to catch your breath? It is a truly alarming feeling that can leave you wondering what is happening. Yes, severe coughing and wheezing are indeed common and significant indicators that you might be experiencing an asthma attack. These symptoms signal that your airways are narrowing, making breathing difficult and requiring prompt attention. An asthma attack occurs when your airways become inflamed, swell, and tighten, a process called bronchoconstriction. They also produce extra mucus. This combination traps air and causes the characteristic whistling sound, which is wheezing, and your body's natural response to clear the obstruction is persistent coughing. It is not just a simple cough or cold, but a distinct medical event where the muscles around your airways constrict, further restricting airflow. Understanding this underlying mechanism helps you recognize the severity of these symptoms. If you experience severe coughing and wheezing, the first and most crucial step is to follow your personal asthma action plan. This plan, developed with your doctor, typically outlines when and how to use your quick relief or rescue inhaler. Take the prescribed puffs of your rescue inhaler as instructed. After waiting the recommended time, usually 15 to 20 minutes, assess your breathing. If symptoms do not improve within that time frame, or if they worsen, it is time to seek immediate medical help, perhaps by calling emergency services. Recognizing early warning signs can make a significant difference. Many people with asthma use a peak flow meter, which measures how fast air leaves your lungs, to detect airway narrowing even before symptoms become severe. Knowing your personal best peak flow reading allows you to identify when your lung function is decreasing, indicating a potential flare-up or attack before it escalates. Taking quick action when you notice severe coughing and wheezing can help you manage an asthma attack effectively and prevent it from becoming a life-threatening emergency. Empower yourself by understanding these crucial symptoms and knowing exactly how to respond according to your doctor's guidance.